Welcome to Toronto Children's Services Screening Tips and Considerations training module. Screening is conducted to limit the introduction of infectious disease into the program. Agencies must create their own screening processes. The latest symptoms for screening and exclusion can be found on the Ontario Ministry of Health webpage under Guidance Documents. This document is updated periodically, and screening processes should be modified accordingly. All providers, parents, and agency staff should be aware of signs and symptoms of COVID-19. Every child and visitor to the home must be screened prior to entering the childcare setting. The provider and residents of the home must also be screened each day before receiving children into care. If conducting screenings at the childcare provider's home, there must be a designated screening area outside or near the main entrance of the home. If this is not feasible for home childcare operators, then they should arrange to use an area or space where physical distancing can be maintained. Only one entrance or exit should be used. If possible, it is recommended that visual lines such as tape markings be used to identify where families are to stand to ensure safe physical distancing when the provider is conducting the screening. Print and post Toronto Public Health signage in a visible location at the designated screening station to raise awareness about health and safety measures that can help prevent the spread of COVID-19, such as physical distancing, protect yourself, information about COVID-19, wash your hands, cover your cough, and posters for entrances. The screening area must be disinfected after each child and as needed. Alcohol-based hand sanitizer is available in the screening area and is out of reach of children. If it's not feasible to conduct screening and temperature checks on site, they can be conducted prior to arrival by the parent over the telephone or by using video conferencing with the provider. These arrangements may be made in advance with the child's parent or guardian. Prior to receiving children into care, home childcare providers must also conduct daily screenings of other persons living in the home, regardless of whether these persons participate in home childcare activities. When the provider is conducting the screening on site, which includes taking the child's temperature, the provider must wear a surgical mask and eye protection, for example, goggles or a face shield. Gloves must be worn when it is anticipated that hands will come into contact with mucous membranes, broken skin, tissue, blood, bodily fluids, secretions, excretions, contaminated equipment, or environmental services. The screening area can be equipped with a table or basket with the following items: health screening forms, pens, tissues, hand sanitizer, thermometer and caps, disinfecting wipes, gloves, surgical masks, and COVID-19 resources. Upon arrival at the home, the family should be greeted and requested that only one adult enters the screening area with the child. It is recommended that both the adult and the child use hand sanitizer. It is important that the adult and child should not move past the screening area into the home. Using the most recent screening questions from the Ministry of Health, ask for a yes or no response for each of the questions. Then take the child's temperature, recording all the information. All childcare licensees must maintain daily records of screening results. Records are to be kept on the premises. Remember, the thermometer must be disinfected after each use, and if disposable ear cups are used, they must be immediately discarded into the garbage. If the individual answers no to all questions and does not have a fever, which is 37.8 degrees Celsius or above, record no on their health screening checklist. They have passed the screening and the child can enter the home. If the individual answers yes to any of the screening questions, refuses to answer, or has a fever, record it on the health screening checklist. They have failed the screening and cannot enter the home. Direct these individuals to visit the Toronto Public Health website to learn about assessment centres and testing. Ensure that door handles and any other surfaces the individual has touched are disinfected immediately while you are wearing a mask and gloves. Perform hand hygiene before and after glove use. Pre-screening is conducted by an individual prior to leaving their home to attend a childcare program. For example, a parent pre-screens their child before going to childcare. In addition, any persons living within the home settings must be screened. When you pre-screen, check for temperature. A fever is a temperature at above 37.8 Celsius. And check for any symptoms of COVID-19. If the child, home childcare staff, or home residents exhibit any symptoms or have a fever, they must be directed to visit the Toronto Public Health website to learn about assessment centres and testing. That concludes the screening training module. Please inform your home visitor that you have completed this training module. We have provided a list of additional resources for you to access related to screening processes. They can be found on the website along with this video.